everyone, my name is Maria Lorenzini. I'm a nutrition student from the University of Massachusetts, and I made my final project about how high sugar diets impact the insulin and glucagon metabolism and promote obesity. After eating a meal, the pancreas secretes insulin to decrease the glucose on the bloodstream by the stimulation of anabolic processes. And after a few hours of observation, the pancreas secretes glucagon to increase the blood glucose stimulating catabolic processes that release glucose. Here we have a graphic to explain the insulin metabolism. After the sugar is absorbed in the small intestine, as glucose, it passes into the bloodstream. Blood glucose levels increase, and the pancreas releases insulin to promote the entry of glucose into the cell. Insulin binds the insulin receptor in the cell membrane, allowing the entry of glucose into the cell to produce energy. So far, the function of insulin is helpful and simple. It takes glucose from the blood and helps it enter the cell to be used as energy. But what happens when we consume too much sugar? After a meal, if there is no more food and the insulin level decreases and at its normal level in blood. But what happens when we consume too much sugar? When the intake of sugar absorbed as glucose in the small intestine is sustained, the pancreas produces and releases more and more insulin. Regulation of glucose metabolism is not the only function of insulin. The hormone also regulates functions in the adipocyte. Insulin promotes the storage of triglycerides through different mechanisms, including fostering the differentiation of pre-adipocytes to adipocytes, stimulating lipogenesis, and inhibiting lipolysis. Insulin also increases the uptake of fatty acid from the lipoprotein by stimulating lipase activity in the adipose tissue. Normal levels of insulin in our body is good for us. However, when the insulin levels begin to increase, it stimulates the metabolic processes mentioned. These processes promote the storage of triglyceride in the adipocyte, in other words, the storage of fat in the adipose tissue. Since obesity is defined as an abnormal increase in adipocyte tissue, we can say that high levels of insulin predispose the, to the development of the disease. Permanently elevated insulin concentrations in the blood are often considered an attempt to overcome insulin resistance. Insulin resistance is a metabolic disorder in which the insulin receptors in the cell do not function properly, preventing the hormone from doing its job. If insulin is not able to do its job, glucose remains in the blood, stimulating the pancreas to secrete even more insulin. The combination of hyperinsulinemia and insulin resistance is a possible precursor of late complications. The combination of all these factors results in a cycle in which one disorder feeds the other, which means that they are mutually related and engage each other. Insulin-resistant raises the body fat content increase, implying that the amount of body fat influences insulin sensitivity. All sides of adipocyte are not equal. Central or intra-abdominal depots of fat are much strongly linked to insulin resistance, increasing even more the risk of further complications such as type 2 diabetes and cardiovascular disease. As a positive side, this can often be prevented and treated before more severe pathologies develop. While most of the time medical intervention is needed, diet is a very influential factor in the prevention and treatment of this metabolic disorder. Decreased consumption of high sugar foods, incorporate low glycemic index foods, increased consumption of high fiber foods, a proper distribution of meals during the day, and daily physical activity can be of great help. The aim is to prevent insulin peaks by slowing down the digestion and absorption of glucose in the gastrointestinal tract, preventing the sudden and sustained secretion of insulin.